So how do we find these trigger points? We've spoken in quite a lot of detail. We've spoken about the sort of hypothesis behind trigger points, what they are. We've spoken about some sort of causes of them. We've spoken about some of the science behind it. But at the end of the day, it's all very well bearing in mind we're not able to put people under electron microscopes or cut bits out of them. How do we find this source of pain? So, although some trigger points cause local pain, it's a mistake to sort of assume that the problem is at that place that hurts, because the pain could be from the pain patterns. And this is where the books on trigger point patterns is very useful, because it gives us a go-to sort of point to look at. We could remember that a particular type of pain is caused and a particular area of pain is caused, and it could come from trigger points in quadratus lumborum, to give an example, and therefore it may mimic certain things, and we can go then and start looking. Remember, nowadays we're not really looking at X marks the spot, but X marks the spot might be a good place to start. We can look at that and find the point, and maybe then search around and consider that along with the pain referral patterns. Pain referral, it can be useful diagnosis. It helps us, as I've said, and then we can use the palpation to sort of particularly sustained palpation to help us find more areas of the pain referral. The most reliable criterion for detecting a trigger point is considered to be extreme tenderness, and this is in the clinical setting again. One seeks the spot that hurts, press on it, and that's the spot that hurts the most, and then maybe if you press on it long enough you will get a referral of the pain. However, the reliability of trigger point diagnosis by palpation alone has been questioned by the research, and it's one of the things that has been considered, and is sometimes where you get a lot of the work on mention of problems with trigger points from the detractors of the idea of trigger points. So it's a good idea to try and link what the patient feels or the symptoms with other subjective signs, things that we find with our fingers, things that the patients are feeling with the subjective signs of the patient. So we can talk about a checklist of trigger points. Now, if you have more than half of this checklist of trigger points, and so no other apparent explanation for it, then the chances are you've got a trigger point or two in the area. So a trigger point, you're likely to possibly have a trigger point if you have sore spots in the muscles. Your pain usually occurs in a specific area of your body. The problem feels more like a muscle than a joint. Your pain is a sort of primary dull aching and nagging. Bear in mind it can be something else. You feel a lot of stiffness as well as pain. The affected area feels kind of weak and heavy. Now, stretching is appealing. It feels good, but it's not very effective. So just by the fact that doesn't work gives you an idea maybe it's a trigger point. However, heating the area, hot showers, baths, sort of hot packs, that sort of thing, heat lamps, can be very effective in calming it off. This may be because the blood flows into the area and the trigger point dissipates. Anti-inflammatories often don't work. You take them, it may sort of clear the pain, but it doesn't really clear the problem, and it's usually only temporary. So if you've got any half of those 9, so 4.5, which would be quite hard to have, but if you're likely to get sort of 5 out of 9, there's a chance that you've got a trigger point. But it's unlikely to be a trigger point if it's like this kind of bruising, sensitivity to post-exercise muscle soreness, that sort of thing. Extreme sensitivity to light pressure, this hyperalgesia, that's unlikely to be a trigger point. The pain, it could be consistent and sharp and related to movement. That might not be a trigger point. The progressive sort of worsening of a pain for no reason, where it's getting worse and worse and worse, and there's no reason for it, unlikely to be a trigger point. Any sort of muscle wasting that's accompanying it, or this electrical nerval type pain, zinging pain. This instantaneous pain, a trigger point usually takes a bit longer to form. sort of mobile bumps under the skin, they're not trigger points. And itching, sometimes itching, that's not usually a trigger point. But again, sometimes you do get these kind of neurological, these sort of tingling type of things that can be trigger points. It's usually the other things that I mentioned. The aim of the therapist is to get to the right area and search that spot for this exquisite sort of tender spot. And don't be too discouraged if you don't find them, because sometimes these little nodules, these little lesions are microscopic and you can't feel those, so good luck with that. You're not really going to have much luck with that. So the idea of us is to try and, of the therapist, is to try and find these areas. So, as I said, trigger points may be like a little tight area of muscle. You push on it, it doesn't feel very mobile in relation to the other parts of the muscle around it rather than other structures. There may be like three-dimensional knots or lumps and the size vary, but they're often located in the most intense area of tenderness, but they sometimes cannot be felt, and so one needs to consider that. So link what you're feeling with your fingers with the symptoms and the subjective signs, like the checklist that we just spoke about. There are another things that I use fairly commonly. 4 main things to help me sort of confirm a trigger point diagnosis. 2 of the 4 elements, factors, points, come from the trigger point's owner, and 2 of the factors are signs that are felt by the person whose hands are on the job, the therapist. So from the patient's point of view, or the client's point of view, you're going to get a kind of familiar sensitivity. It will often feel like a sort of problem that they've had in the past. So, yeah, that's what's bothering me. It's bothered me in the past. Yeah, that's the familiar sort of thing. They feel like you're on the right spot there. That's often the thing they say, yeah, you're on the right spot. That's kind of relevant to the problem, or related or connected to the problem I've had. Sometimes it may not be that obvious, but it's usually connected. It's similar to a symptom that the patient's been having. And then you get this intense and distinct sensitivity. It will be the most sensitive spot in the area. There could be a wide variety of pain. As we said, it could be a dull, sickening pain. But paradoxically, it's one of these things that the pain goes away as you're treating the trigger point, which is what I mentioned earlier on. As you deactivate it, you're treating it. That may be a sign that you're on a trigger point. It's that good pain. Oh, yeah, you're on the spot there. Oh, that's a good pain. Those sort of 2 things that the patient will say. It contrasts sharply to the sort of pain that isn't a good pain, and the stress from injured tissue, which definitely doesn't feel very good. Well, get your fingers out there, that hurts. This is more likely the answer. But the trigger point is, oh yeah, you seem to be on the right spot. That suits what I used to have. That's a kind of good pain. They're the 2 sort of things that patients will often say, and you've probably seen that. From the therapist's point of view, one of the things that most therapists profess to feeling, and I smile because it's a thing people say you don't feel that, is this kind of tight band, this strap of muscle. It's distinct. I personally, I'm pretty sure I'm feeling a difference between the muscle. If I can touch somebody and feel a difference in sort of stiffness in their joint or the way their tissue is moving, I can often feel like the muscle may be a bit bunched up, not as mobile, not as flexible as other parts of the muscle. Some fibers might be tighter than others. There may be like a little distinct knot. It could be absent, and the knot might not be there, but often you do sort of kind of feel this sort of thing. Sometimes you have to be careful because there could be lots of other trigger points and you're not on just one, and finding the actual primary one is more complicated. But it's one of the diagnostic signs that is reported very, very often by clinicians over the decades. And then you get this like little twitch. This is the second sign. This little muscle kind of twitches and jumps if you hit the sensitive spot. This jump sign, this tender area that. But be careful, especially when you're not used to it, that it's not a patient jumping because of pain. It's something that's actually jumping underneath your fingers. So one needs to be aware of that. But it's almost an isolated, distinct muscle twitched, and that's a good sign that you're pressing on a trigger point. So progressing from there, the first key is to kind of notice if you're able to keep the discomfort to a moderate level while you're treating, and eventually the trigger point with successive treatments will get less and less. And again, back to this deactivating the trigger point gives you an idea that you're treating a trigger point. But these are the ideal situation. If the situation does not improve, one should seek some medical referral, or send them to a physician to check that there's not something else going on that could be more sinister. Now, one should be cautious, particularly when we're looking for things, particularly when we're going to treat. We need to look at things. Be very cautious, like when you're doing any sort of massage. You don't want to massage over a pulse. If you can feel something throbbing away underneath your fingers and it's a pulse, don't go massaging around there. It's an artery. Arteries supply fresh blood to the whole of the body, and if you sort of shift something, cause a thrombus, maybe like an accumulated plaque or something like that, and you send that off to a more sensitive part of the body, like the brain, one needs to be very, very cautious about this. Another thing is when you're palpating, you may feel like you're over the lymph system. The lymphatic system, you will find a swollen nymph. Normally a healthy nymph feels like a little bean, but if it's sort of swollen and lumpy, that may be something going on with the lymphatic system. So again, re-refer. They can feel sort of hard and tender and inflamed or enlarged, the lymph nodes, when you're palpating, so you don't want to be pressing or pinching on those. Caution again, any sort of fever, skin infections, contact dermatitis, acute systemic infections such as a virus or kidney failures, and serious health conditions need the okay from a physician, a medical okay. Aneurysms, atherosclerosis, cancer, heart failure, congestive heart failure, coronary heart disease, peritonitis, polycystic kidney disease. These are things that really need to be okayed by the medical practitioners. Contraindications for massage therapy. Werner, in 2013, came up with a lot of them. Now, he wrote them down as contraindications. Some of these are more cautions and one should check with the doctor, but the list he wrote was fever, liver cirrhosis, pitting edema, blood clots, broken bones. Well, listen, somebody with blood clots is not, or pitting edema is not likely to let you get anywhere near them to treat them for trigger points. Certainly, well, blood clots less so, but broken bones most definitely. Deep vein thrombosis, one needs to be very careful. Embolisms, attacks of fainting for no reason, uncontrolled blood pressure, intestinal obstructions, lymphangitis, myocarditis, rheumatoid arthritis, tumours, seizures, or tuberculosis. Again, I think these are more should fall into the region of cautions and precautions rather than completely stopping you from trying to treat, because sometimes trigger points can sort of mimic some of these things. But if there's any risk of these problems, get a medical okay or check everything's stable. So they're basically sort of how to define trigger points. Use your subjective checklist along with your 4 points, the sort of distinct sensitivity, you're on the right spot, familiar pain from the patient, along with the twitchy sort of jump sign and the muscle band underneath your thumbs, and you're probably likely to be on a trigger point. And then as you treat, as you go through the process, the pain or the problem or the dysfunction will alleviate, and if that's the case, you know you're in the right direction. If you're not, then re-refer, especially if the patient presents with any of the sort of special questions that we just covered.